Dear Mrs. Georgieva, dear organizers, colleagues, guests, who gave us the opportunity to us, the social partners, to take part in this beneficial and highly responsible session of the public employment services. And we will respond with responsibility and commitment to this problem. For me, it was extremely useful to take part in the plenary sessions. And let me share some of our experience and social partners in resolving the problems of the aging. The European Union found a while ago, in the year of the aging populations, that the aging population is important for all of us, and Bulgaria then adopted a policy to restoring the place of the elderly in the labor market. Therefore, the Confederation of the Independent Syndicate works towards building a dignified life of the elderly and restoring them on the labor market by taking into account their health problems. And we focus on resolving their problems over returning them to an active life by taking into account, as I already said, their health and social problems based on lifelong learning and allowing them to increase their competencies, skills, and requalifying them to continue to be present on the labor market. This project we did continues due to the high interest on part of the employers, both employers and beneficiaries. Out of 1,000 people in 2012, the people willing to take part in the project, the number of applications received by the employers eager to employ people over 55 are for 4,000 people. This shows how successful and committed this project is. But it wouldn't have been like this without the collaboration of the government, syndicates, and employers. Let me emphasize on some important elements of the project. What was our approach? The project was based on an in-depth analysis on the willingness of the elderly to continue their working life and adapt again to the active social life. Their willingness was to work, as they say, in white working places, white working places. We included a new profession, social worker, for working with children. The employers for whom our beneficiaries train and work for are all healthcare institutions throughout the country, all private enterprises aimed at improving the services for the populations. That's why we call them white jobs. Every person willing can be included, and the selection is done in the labor offices in all branches of the public employment service. The employer and the syndicates also take part. The project is a national one. It covers all towns and districts throughout Bulgaria. The selection is not group, it is individual. The three representatives meet individually, all our colleagues willing to work people over the age of 50. The target group is the long-term unemployed elderly who have been unemployed over 12 months. Due to their willingness, because of their willingness, we formed groups and we guided the employers to the various groups. The employers, on their part, exhibited very good precision in the selection of the employees they need, making a very good analysis of their personal qualities, of their former competencies and skills, which helped our organization syndicate to decide what modules and what degrees of training to include in the programs. So there was self-assessment and assessment, and this helped us to direct those people to the profession of carer and carer of the sick and elderly. This was done taking into account the vacancies in the healthcare institutions, and it allowed the trainees to adapt properly to their jobs. The trainers were the people who are actually working in the healthcare institutions, and it helped the elderly to adapt easier even in the course of work. So out of 4,200 people trained in the healthcare institutions, until now 1,600 people are on permanent labor contracts and continue their working life. Very big credit which we can say of our former unemployed, is that they managed to prove their abilities to their younger colleagues in the healthcare institutions, and particularly the attitude due to their age. A big part of them found jobs in Germany and Switzerland and in the UK, in Austria, and mostly in Greece and Turkey, where they were employed by private homes, by families, to take care of the elderly and the sick in those countries. The project was successful and important because it was in collaboration with our partners, the employers, with our government institutions, and we as a syndicate believe, as a trade union, that prolonging the working life of the elderly can only happen when it is in close collaboration with the government and the general public. The elderly deserve our assistance, and they give back to the society. Thank you for your attention, and I wish all the best to all the participants.